and good to have you with us on tonight's Urban Debate. The day that Indians have been waiting for with bated breath is almost here. Tomorrow, by this time, we would have witnessed the first round, the first batch of people getting vaccinated, getting the vaccine shot to battle the deadly coronavirus. After day and night efforts by our esteemed scientists and literally a very fast-paced research and development, India has got approval to use two indigenously manufactured vaccines, Covishield and Covaxin. So here is how the day will really start tomorrow. The vaccine centers across the country will begin to function from about 8 a.m. to 9 p.m. depending on really which state you are in. There are roughly about 3,000 centers that have been set up. The Prime Minister himself will launch the Vaccination Drive virtually and officially at about 10:30 a.m. He will also launch the CoWIN app officially, although it is already operational, for real-time monitoring as far as the vaccinators and the beneficiaries are concerned. 3,006 vaccine sites, to be precise, have been set up across India. And at each of these sites, about 100 people will get vaccinated tomorrow. In all, in the phase 1, about 3 lakh healthcare workers and frontline warriors, frontline workers will get the vaccine shots. And there are 2 shots for each of these vaccines. Remember that. 2 doses that every person will have to get. All of this will be done via the CoWIN app. And if there are any emergencies or any issues, there's also been a 24/7 call center that has been set up. The number is 1075. So tonight we decided that if you are still confused, if you still have doubts, concerns, then let us open our phone lines and address all of those fears and concerns in your minds, whether it's about the vaccine, the vaccination, the process, the app, the side effects, the follow-up, or whether simply to ask, when will your turn come? Honestly, we don't have too many detailed answers for that one, but the idea is to help you understand the whole process as much as we can. So pick up your phone and call us on the numbers that are flashing on your screens. Our panel of experts will try and address as many of your queries as we can. So let me actually quickly say good evening to the panelists who are joining us this evening. Dr. Suresh Kumar, Medical Director for the LNJP Hospital from Delhi, is with us this evening. Dr. Sudarshan Ballal, Chairman for the Manipal Hospital, with us. Dr. Om Shrivastava, Director for Infectious Diseases at Jaslok Hospital and Research Center in Mumbai. Dr. Anish Sinha, Associate Professor at IIPH in Gandhinagar. He's worked with WHO and UNDP when it comes to several immunization programs. And Dr. Rajiv Seth, Senior Pediatrician and expert on vaccine and Medical Director for Child Health and Development Center in the National Capital. Great to have all of you with us. Thank you so much for joining us on this special show. Let me just first start off by asking a simple question. Now, while tomorrow is a great symbolic day, Dr. Suresh Kumar, and we start off with our vaccine process, to your mind, how long is it going to take for a majority of the country to get vaccinated?
Tomorrow is the great day for the country, and all doctor community, paramedics, and all nursing officials are excited about the vaccine. First of all, it is great matter of pride for Indian scientists and doctors that it is homemade, and we are happy to have the vaccine in all our major hospitals across India. And we have been suffering for a long time because of this COVID pandemic, and now time has come that we want to get rid of this menace of this deadly disease. And I hope that your question is how long it will take to immunize majority of the population. You see, India is a big country. It takes time, but definitely the healthcare workers are the first line worker, and we hope that this exercise will be completed in 2 to 3 months.
Okay, so the exercise that you're saying to be completed in 2 to 3 months, of course, Dr. Suresh Kumar, you mean for the 3 crore workers, healthcare workers, and frontline workers who've been identified, and then we will begin to include other parts of our population, isn't it?
Because one has to take 2 doses.
Yes.
So to have 2 doses, it requires 6 weeks to at least 2 to 3 months time.
Yes, absolutely. Let me also bring in Dr. Sudarshan Ballal, Chairman of the Manipal Hospital. Good evening to you, Dr. Balal, and thank you for being with us. I just wanted to understand from you, what is going to be the biggest challenge to your mind to reach out to those who are not in the system without identification, to convince those who may have fears about the vaccine itself, or to tackle the fake news that's really going around at this point?
Thank you very much for having me here. It's a pleasure to be here. I think it truly is a red letter day for the medical fraternity. After a long battle and being bruised and battered by COVID, we finally have some light at the end of the tunnel with the vaccine being rolled out by the Honorable Prime Minister tomorrow. Of course, India is a huge country with a population of almost 1.4 billion. And we have a very diverse population and a very diverse geography. So reaching everyone is certainly a challenge, but I think the government is sort of well prepared. And the way I see it, they're almost launching it like a massive election campaign, and also a combination of election campaign and the experience we have had with other vaccines, albeit a little different, like the polio vaccines. I have never seen so much of preparation for any vaccine in my 5 decades of being in the medical field. So I think the challenge certainly would be, one, is the logistics of supplying the vaccine and vaccinating the huge number of people in remote areas and different parts of the country. The second point, which to me is very important, is that there's a lot of falsehood, rumors, and fake news about the side effects and the dangers of vaccine. And this is something that we really, really need to get rid of, create enough awareness. Because a lot of people, even if the vaccine is available, which to me is like a life-saving drug, they don't want to take it. So I think we should, especially people in the media like you, who have a large clout in influencing the public, should go all out and make sure that people do come out in large numbers and get vaccinated. The third is, of course, we have a prioritization: medical workers, frontline workers, people over the age of 50, people under the age of 50 with comorbidities, and lastly, the general population. So it will be done in a very phased manner. And I think ultimately probably close to 300 million people will be vaccinated. So I think it's a huge challenge, but I believe we are geared to have this. In my opinion, the logistics and the falsehoods and the rumors, definitely something that we need to overcome.
Yes, I think the rumors, and the myths that surround the vaccine, this specific vaccine, and the falsehoods, the scams, and I think that's going to be one big point that we will keep focusing on from here on. So many smaller, news reports which have already begun to emerge of people trying to fool others into saying, oh, we have the vaccine, we have some shots, we can sell it to you, and we will give you the money. Right now, the vaccine's not there in the open market. So please, if somebody tries to fool you like that and take some money from you, do not believe that. Right now, it's all being done by the state, by the government, and it is specifically for the healthcare workers and the frontline workers. Dr. Anish Sinha, good evening to you. To get a sense of, what it is within the medical fraternity, since it's the medical fraternity that will get the vaccine first, what are the conversations like? How are people, preparing themselves for what's coming?
Yeah, so actually tomorrow is a big day, and the end of COVID is tomorrow is the beginning of that. So the medical fraternity is very excited. They were actually initially last 2-3 months back, if you look, there were some hiccups among them. But with more data available, with more clarity on the trials, on the vaccine availability, on the side effects of all. So now the medical fraternity is very convinced that it is for the good and the benefits are much more than the risk involved. So they are very excited, and I'm sure that this campaign will go ahead as planned. And in the first priority, like the medical health professionals, the paramedics, and all those working in the health sector, then the frontline workers, and then the remaining above 50 and below 50 with comorbidity, above 50 also. This is what the 30 crore first wave of vaccination. And the whole plan is to complete this by June or July. So it's an ambitious target, but very much achievable. So I'm sure this will be a very good beginning tomorrow with so many of inaugurations right from the center. The states have also planned at different levels to gain confidence of the implementer and also the people who will be getting these vaccines tomorrow.
Okay, Dr. Om Srivastava, good evening to you. A lot of people are asking us whether we will have a choice. The answer for now is no. But does it matter? Is there a huge difference basis, of course, the data that we have right now to be able to at some point choose which one suits us better?
It's a very good question, Tanvi. Hello, good evening. Is it likely that we'll be having more than one choice as to which vaccine we are going to take? Yes, I think that's likely to happen. And it's probably going to happen in the very foreseeable future, maybe before June, July, August, sometime there. Because there are a number of other players in the market which are into the phase 3, and they will be getting their approval so long as their paperwork is thorough. Does it matter? I think it does. I think it does because some of the vaccines are absolutely brand new technologies, like the messenger RNA vaccines. Some of the other technologies have been used in other vaccines as well, like the vector technologies. And there are those that are going to be a hybrid of some other technologies. So yes, it will make a difference. And that will probably come to a stage in the very foreseeable future where a vaccine may be customized based on the overall information that is available with the patient. That means what is your comorbidity? Is it likely to have a look at your genetic fingerprinting? I think we're probably heading in that direction. This is my personal opinion. We'll probably be heading in that direction where we will be able to customize a vaccine such as this in people who have either bigger comorbidities or higher risks, and probably offer them the vaccine which is most likely to be suited to them. So I would think that yes, in terms of choices, I would think in the next 4 or 6 months' time, we are going to be having a lot more choices, and that it probably is important to have a look as to what is the response of the vaccine in the next, like I said, 4 or 6 months' time. That is why it's also very important from here onwards. One part is the availability of the vaccine. The other part is going to be having robust data of people who've had the vaccine. The follow-ups, the records, the side effects, of course, is one thing, but also looking at complete data on that part and what might be the best next step, because these vaccine availabilities will get refined over a period of time as to who are the best suited people to which vaccine. So I think it's going to be another humongous exercise, but why not? I think considering the magnitude of the problem, it's only going to be something that can be done. It'll have to be done.
Yes, absolutely. So let me ask this question, and Dr. Balal, maybe you can come in on this. Like several experts have told us in the past, for those with comorbidities, perhaps a deeper scrutiny will be required of what is suitable for you, whether you should take it at this point or not. But what about the 3 crore people who are there in phase 1? How do they get to then decide, or where do they get that consultation?
Well, you have asked a very important question. This is particularly dear to my heart because I deal with a lot of people with comorbidities, being a kidney specialist. So we have a lot of patients with diabetes, hypertension. And of course, we also deal with a lot of kidney transplant patients who are immunosuppressed. So we have done a fair amount of work, and there has been extensive discussions. And there are some vaccines that are not contraindicated, but fortunately for us, both Covishield and Covaxin are not contraindicated in these comorbid patients. So I think my answer to the patients with comorbidities is that by and large, most of them can take both these vaccines. However, there will be some live attenuated vaccines which they cannot take. But we don't have them in India right now, so that we can park aside or leave it aside. Now, for the 3 crore people who have already been listed for the vaccination, the rules of engagement remain the same. All high-risk patients of exposure and getting COVID should be vaccinated, and that is our healthcare workers, frontline workers like BBMP, police, ASHA workers, nurses, technicians, paramedics, etc., etc. And the rules of engagement will be the same even for them. If there is a contraindication, right now the contraindications are for vaccination, or the guidelines not to vaccinate is pregnancy, lactation, age below 12. So this holds good even for this category of the medical and frontline warriors who will be vaccinated in the first phase.
But what if there are some frontline warriors and healthcare workers who also have some of these comorbidities where a deeper scrutiny is required? Are they not on this list?
Well, they'll still be on this list because there is no contraindications or guidelines other than the ones that I mentioned.
Correct.
Pregnancy, lactation, children below 12. If you have any other comorbidities, be it cancer, be it diabetes, kidney disease, transplantation, you can still be vaccinated. And there are a lot of healthcare workers who have these comorbidities. Personally, we take care of many of them and we recommend vaccination for them.
Yes, because, and Dr. Sinha, would you like to come in on this as well? Because, you know, the last few times we had these conversations and we opened up to people, many people had this query, especially those who were going through, you know, cancer treatment, chemotherapy or immunotherapy, asking what should they do?
Yeah, as the other speaker rightly said that the all comorbidities, these 2 vaccines, both the Covishield and Covaxin, are not contraindicated in all these comorbidities, whether it's hypertension, diabetes, cancer, or any other disease, except for the 2 like the pregnancy and lactation. It's like pregnancy and lactation because there are no trial happened in them and the data is not available. So that's why there is a contraindication for this pregnancy and lactation. Otherwise, and the age group, like the Covishield, it can be given only, it cannot be given to less than 18 because there has no trial among them. So otherwise, there is no specific contraindication to these vaccines. So they will be given to them. And after vaccination, they will be asked to stay there for 30 minutes as an observation. So that is good enough for taking care of all after vaccination.
Okay, so let me pick up on one of those, you know, categories and say good evening to Dr. Rajiv Seth as well, senior pediatrician joining us this evening. Dr. Seth, many of the parents that I've spoken to have also said that, you know, we have this dilemma right now about taking the vaccine. We can't give it to our children. What about a vaccine for children? Is that going to take a few years, a deeper study? You know, any light that you can shed on that?
Yes, thank you very much for this. Children are not going to get any vaccine for now, but the research is going on. And I think once the trials happen in children, and there are bridge studies they can do and fast track the trials on children as well in India. And once that happens, the children will be eligible to get these vaccines. As of now, children are not a very high risk group, but we know that about 7 to 8% of all COVID cases happen in children. And 70% of these children are asymptomatic, like they do not even have fever, cough, breathing difficulty, or any symptoms. So these children sometimes can act as super spreaders, spread it to their senior citizens and people with comorbidities in their families. And therefore, the children will also need vaccination. Also, you remember, children are right now, more than 1.6 billion children are out of schools now because of COVID worldwide. So these children will have to eventually go to school. And if they are fully vaccinated, they'll be safer in the school setting as well. So eventually the children will be immunized, but only after their safety efficacy trials happen in children. So right now, the panelist before me was right that Covishield is not licensed to be used below 18 and Bharat Biotech is, I think, up to 15 and above. So I think we'll have to wait for our children. But while we are waiting for the children, my message to all the parents are that please continue your routine vaccinations for children. What we have seen is after the COVID pandemic took place, the parents were so scared that they were not bringing their children for routine vaccinations. And therefore, we are seeing a higher prevalence of diseases which are due to lack of vaccinations, routine vaccinations, which are licensed for normal use in children. So like pneumonia vaccines, like Haemophilus influenza, polio vaccines, the DPT vaccines, the MMR vaccines. So children need to be vaccinated. We have just completed a study, the Indian Academy of Pediatrics with the Johns Hopkins, and the preliminary data has shown that after the government lockdown, more than 60 to 70% of the children failed to get their routine vaccinations. And even after the lockdown closed, and even now, the pickup is about 25 to 30% more than the baseline from there. So essentially, parents are scared of bringing their children for vaccinations. So if the children don't get vaccination, India has achieved a lot in child health care and reduction in mortality, morbidities in children diseases. But if they don't get their routine vaccines because the parents are scared of taking them to the centers for vaccination, I think it'll be counterproductive.
Yes.
And yes, so this is a very central message to the families. And I hope you agree that the indirect effect of COVID on children is devastation.
Yes.
The children are getting malnourished. All the midday meal programs for the poor and the vulnerable have stopped after the COVID, and the children are not getting their midday meals. So there's more malnutrition, more anemia in children. And so we are going to see a lot of crisis if we don't take our children well.
Oh, yes, absolutely. In fact, the government has, though, promised that the rest of the healthcare services, and especially the vaccination plans and the immunization drives, will not get impacted. And, like Dr. Rajiv was pointing out, we can't afford to do that. And so that part of our program still has to continue. I have our first viewer caller on the phone line. Dr. Vijay Seshan is calling us from Pune. Good evening, Dr. Vijay. What would you like to know?
Good evening. I am Dr. Vijay Seshan, physician. In 2003, I had a flu shot in UK, and I developed Guillain-Barré syndrome after that. Now I am having myasthenia gravis, diabetes, blood pressure, and asthma. Is COVID shield or COVID better for me? Which vaccine is better? Because one is a active virus, one is a dead virus.
Right. Okay, thank you for that query. Dr. Suresh Kumar, would you like to take it, or otherwise Dr. Om Srivastava?
Yes, this doctor has multiple problems because already have Guillain-Barré and other problems, already needs more special care. We have many trials going on, and we have the safety and efficacy issue already tested. Phase 3 trial have seen that both the vaccines are safe. More than 23,000 persons were given the inoculation, and hardly any have any problem with these vaccines. So only minor allergic problems were there in both the groups, but still there are some case reports from the UK and other European countries that one in many thousand patient might develop some problems. That may be because of some per se defect in the immunity, or because of the coexisting illnesses, or some complication because of their own immunity. So to say that a person may have some very serious side effect is very, very rare. And we don't recommend these vaccines if patient have received plasma therapy, or if patient received monoclonal antibodies, or patient have some sort of severe acute or chronic problems. So it needs more care in your case.
Okay. Dr. Srivastava, is there anything else you would like to add, or would you agree? Because I think a lot of, again, it comes back to that question, if either of the two medicines suit better in such a scenario. Which, I mean, we don't have a choice today, but still.
Now, he's talking about the influenza vaccine, right? Yes. I think that is different to the vaccines that we're talking about right now. I don't think you can compare millimole to millimole both the vaccines. That is one. The second part is that the incidence of Guillain-Barré syndrome after the influenza vaccine is actually very rare. It's very rare. And that the incidence of the other conditions that he mentioned, whether it is myasthenia, they are all going to be following a pattern that involves your immune system. So it needs to be looked at in that light, not in the light of the vaccine. I don't think that a vaccine-induced myasthenia gravis or a vaccine-induced autoimmune disorder is something that is going to be the cause and effect in your case, Dr. Seshan. I think it would be more practical to approach it insofar as whether it is an immune dysfunction, and influenza vaccine leading to any of these conditions is very unlikely. But I see the point you're making. Whether it is safe in your kind of condition, I think in one word, yes, it would be safe. But your physician should be able to first evaluate all your risk before he offers you the vaccine.
Okay, fair enough. Thank you, both of you, for that response. If I can just go across to Vijay Rege on the phone line from Mumbai. Good evening. Go ahead, please.
Good evening. I just wanted to know whether I have a choice of vaccine when I go for vaccination. If there are two vaccines present, Bharat Biotech as well as Serum Institute, whether I have a choice. And secondly, I have comorbidity issues like blood pressure, diabetes, and asthma. So whether I will get the priority in senior citizen category.
Okay, I can tell you that right now, nobody has a choice. Specific doses of one specific brand are being sent to specific regions. It's been allocated already, and the government center is distributing it to all the states in a planned manner. And when you turn up there, you will get whatever is available at that center. There is no choice so far as the government program itself is concerned. Dr. Sinha, do you want to take the second part of his question?
Yeah, very correctly, as you said, the first part, that there will not be a choice at the moment, and the vaccine has been segregated, like specific regions, specific districts will get the specific vaccine, and that the beneficiaries will have to take. The second part is, like your question is that if you have a comorbid, will you get a priority in 50 plus category? So that will be, no further segregation will not be done. Like those who are above 50 will be, because a session will be planned in an area later on. See, now it's only for the health worker, frontline workers, so the number of sessions will be less. Once the 50 plus category starts, so that will be planned in a session, and all will get an equal priority above 50. There will not be any further segregation like above 60 or above 70 or those with comorbidity. That will not be done. So you'll get an equal priority or like any other above 50.
But right now, for example, do we know what are the comorbidities that have been defined? Of course, I mean, above 50 is a different ball game altogether. But otherwise, do we know what comorbidities can actually get priority?
Like above 50 is altogether different. Now, below 50, there is a comorbidity. So what the guidelines were there, like hypertension, diabetes, cancer, and any other long-term disease, chronic diseases that has been included, like it can be renal or liver diseases, but it's a chronic diseases. So they have specified these three: hypertension, diabetes, cancer, and any other chronic diseases. So in fact, invariably, all comorbidities have been included in that.
Okay, fair enough. In fact, the only thing is that, and I'm sure all of you professional experts will agree, that the number of people in our country who unfortunately suffer from one of these comorbidities is such a large number put together that, when we start talking about those below the age of 80 with these conditions, it's going to be a huge number that we start staring at that point. But hopefully by then we would have managed to manufacture a large number of doses, and maybe we would have had them in the open market as well by this summer. That's the hope we are going with. Vineet Venugopal is on the phone line. Good evening, Mr. Venugopal. What's your question?
Madam, can I ask my question right now, madam?
Yes, go ahead, please.
My first question is, registration of beneficiary is mandatory for vaccination for COVID-19. Only after registration, further information on section site to visit and time will be shared with the beneficiary. And my question is, suppose if a person who was registered on the official portal for the vaccination drive fails to turn up due to some unforeseen reasons, will he get another opportunity to get himself vaccinated? That's my first question. My second question is, there are a lot of underwater restaurants located in the world. India too had an underwater restaurant named Real Poseidon in Ahmedabad. It was recently shut down. Since the employees of these restaurants are working underneath the water, do they need vaccination? That's my second question. And my third question to the panel of experts sitting in the debate show is, Maharashtra was planning to demand free COVID-19 vaccine shots for poor people, especially people living below poverty line. That means persons with comorbidities and above 60 years. And Maharashtra was planning to raise this demand with the Ministry of Health and Family Welfare.
Okay.
Has the government taken effective remedies to alleviate the concern raised by the Maharashtra government?
Okay.
That's my third and final question.
Thank you, Vineet, for calling. For your third question, I can say that many of the states have actually also said that they will be, if the center doesn't, the states themselves will look at, some of them have already announced, at making these vaccines available free of cost to the poor and the vulnerable who can't afford. But that's at a later stage, because we still haven't reached that part. Right now, we're talking about the project that's being implemented by the states, overseen by the center for the 3 crore healthcare professionals and frontline workers. What happens if he misses the date? I think that's essentially what Vineet wants to know. Does anybody have an answer to that?
I can try for that if you will.
Yes.
Exactly. See, this is I can share some experiences from the other campaigns, like we have polio campaigns, we have measles rubella campaign. So in measles rubella, if somebody doesn't turn up, and it depends, if the large number doesn't turn up, then a re-sessions, and again another session is planned after a few days, and a second session is done. And if few children did not turn up, then they were mobilized to, like 4 or 5 children didn't turn up for the vaccination against the expected 100. So then these 4 or 5 children were mobilized to another session site. And if 50, 60 didn't turn up for vaccination for one or the other reason, then a second session was planned in the same area. Now for COVID, still tomorrow is the first date. So still we expect that and because there is a robust technology involved in the form of a COVID to send an SMS, and so we expect that majority will turn up for vaccination. So at the moment, to the best of my knowledge, there is what will be done if somebody did not turn up has not been much discussed, or plan is at the moment is not there. Because after some experience of 3-4 days, then
Correct.
the plan be made what to go ahead if there's 4-5 didn't turn up or a large number didn't turn up. Then the plans can be planned after we begin with the campaign tomorrow.
Yes. All right, fair enough. And I think once the app also becomes, public, we'll be able to see, or those who do take a look at it tomorrow and day after, in the next few days, will be able to give us a better sense of how the communication is really taking place, and the real-time tracking is taking place, which will help if you don't turn up for your designated shot. Well, let's go across to Srinivasan on the phone line from Belagavi. Good evening, Srinivasan. What's your query?
Yeah, good evening. My simple question is, if somebody has severe asthma,
right,
and because COVID also affects the breathing, so is he eligible or she eligible for the vaccination, and what will be the consequences, and what are the precautions which one has to take in case of that? Thank you.
Okay, Dr. Srivastava, do you want to take this one as far as asthma or other breathing related issues are concerned?
Yeah, so it's not just asthma. Any kind of hypersensitivity, something that gives your any organ of your body a state of an enhanced reaction to a number of things, is something to be used with caution. It's not a contraindication, but it's meant to be used with caution. That is something that only the person who is dispensing the vaccine or the physician who is making the assessment will decide. Because simply a definition that you go into a breathing disorder because of a seasonal change or an infection does not quantify that you should not get the vaccine, but it has to be moderated. It has to be done with some caution. So yes, it is something to be evaluated carefully. Once that is evaluated, what is the extent of the asthma, what are the triggers, and what are the events that lead to. So there are those asthmas where you will be having slight wheeze. There are those asthmas where patients will go into respiratory distress in such a way that you will need to be hospitalized. You will need a non-breathing mask, non-rebreathing mask. So different stages of different kinds of asthma. What is the state of asthma in your system is something that will need to be evaluated, and that there is caution to be exercised by the attending physician or the person who is dispensing the vaccine before the vaccine should be given to you.
Okay, thank you for that. And of course, our phone lines are open for more people who want to call in and ask their questions. Let me ask this, since you're all from the medical fraternity and those who will be getting the shots are from your fraternity, is there any clarity on how much time is being given to those who get the shots? How much in advance are you told that your date is this, this is when you need to turn up, finish your registration now? Considering that for the healthcare workers who get their shots in the next 1 month, some of this would have already begun. Dr. Balal, if you can shed any light on this.
Yes. Being part of a large hospital chain, we have been in dialogue with the BBFP and the government for quite some time, and they have come and inspected us, done some sort of a dry runs and given us instructions of how it needs to be run. And we now know that our vaccination will be happening on the 17th. And we have written instructions about 48 hours earlier, but oral instructions have been given to us and all preparations have been made based on those oral instructions and constant meetings that were held with our administrators and the BBFP. So I think enough time has been given, but I'm talking about large hospitals which have thousands of employees. So we have some 4,000 plus employees, so we'll have more than 40 stations to vaccinate these people. So I think enough preparation and time has been given, and all the booths to the last T have been planned, how many people per booth, what is their exact role, the data entry, so on and so forth. What is also sort of known is that if you miss the queue, in the sense miss your date for the vaccination, you may have to, the BBFP will have to be informed and they may have to give you another date. It's not that you can just walk in the next day and get vaccinated. There's a process for that. So I would request everyone who's been registered to get a vaccine, try not to miss it unless it's a dire emergency or something that you have no control over. But enough preparation has happened, at least in the large hospital chains. I do not know about individuals.
Right. Okay, Dr. Suresh Kumar, if you can, give us some insights as well on how it is for healthcare workers in the national capital.
In Delhi, we have very robust program, and we have 4,000 employees in the single largest hospital of Delhi, Maulana Azad Medical College, and attached tertiary care teaching hospital. So what we have done that we have given the whole list to the district administration, and they are giving a call 24 hours before the scheduled vaccination. The doctor, nurses, or technician or healthcare worker receive the message on the smartphone or the normal phone, and they confirm that is already registered. And in the morning, the time of vaccination is 9 to 5 p.m. and we call all these employees in the group of 20 so that there is no overcrowding, and everything is monitored, and they are well informed in advance, and it's purely a voluntary process. And there is a lot of happiness and enthusiasm among the doctors, nurses, that they want on day one. We said that only on day one only 100 are allowed. So we have only one booth at our center, but after 2-3 days we are going to open 3 more station or booths. So per day we can vaccinate 300 to 400 healthcare workers. So that is the arrangement we have done.
So how are these text messages and the calls being done, or people being allotted the slots? Is that being centrally done via CoWIN, or is it left to the center which has a list of people in their area and then they draw it up?
It's through the CoWIN app, centrally done, and if some problem is there, then they are also informed telephonically from the hospital site. From our hospital site also, we make sure that the person gets the message.
So people who are making those calls must be receiving a lot of enthusiasm and gratitude from the other end, because whoever is getting a call saying, oh, it's your turn to get the vaccine, must be really excited to know that their turn is next. I can imagine how that conversation would be playing out. We have a caller, in fact, from Delhi, who did get reached out by the volunteers for the registration, I believe. Mr. Anil Kumar Das on the phone line. Good evening, please. Go ahead. Mr. Das, good evening. Can you hear me? Okay, we're going to try and patch that line again with him and listen into what his doubt was. But I'm being told that, people did reach out to him for registration, but he had some doubts. So that's what it is. Meanwhile, let me tell our viewers as well some of the myths that are doing the rounds. Some of them are age-old myths that we've had about vaccines. Some are actually new age, false comments that have also been doing the rounds. And this is what the center has also put out. So the central government is also saying that if you've heard the myth that vaccine is not effective against mutant strain, well, the fact is that there is no such proof that the vaccine is ineffective against the mutant strain. We don't have proof for that to say it's ineffective. How much is it effective? That remains to be seen. That's a different matter altogether. Whether senior citizens and frontline workers who are below the age of 10 years will be vaccinated, no, those below the age of 10 will not be vaccinated at this point of time. Priority is frontline healthcare workers. Priority 2 is senior citizens, those with comorbidities. Priority 3 is other citizens in need. This is the list that the government has made right now. Vaccines in India are less effective compared to other countries is also a myth that the government wants to bust for you. And they say that the vaccines manufactured in India are as effective as against the virus as any other. And remember, the vaccine that Serum Institute is actually manufacturing, Covishield, is actually being developed and researched by Oxford AstraZeneca. So while we have a large role to play there, we're not the only ones. Some of those trials have been conducted outside before the next phase was done in our country. So things that I wanted to tell people, apart from the obvious ones, which by now we know that no, it doesn't lead to any impotency or fertility issues, a big myth that we always hear when something new comes in the medical field. But Dr. Rajiv said, if I can come to you next,
yes.
For a common man who's not on the phase 1 list, how should they prepare themselves to be in a wait and watch mode, to have more options there, to wait for more research, or as soon as the government makes the announcement, try and get themselves registered? What's your own sense for the rest of India's vaccination?
So I would appeal to everybody to remain patient, because the COVID app which the government has now developed is going to be soon operational, and like the priorities you have said, those priorities will be followed. Right now we don't have the COVID app, but that COVID app is the place where you will be asked to register when your time comes. And soon after, they will give you a date and venue where you're going to go and get your vaccinations. Now, and it is, remember one thing, it is not just one dose. It is a 2-dose process. So when your turn comes to get your second booster injection, in a few weeks' time, you will get another message. So it's very important that you comply with these, messages. And obviously your Aadhaar card or iCard and what are the proofs which are all there. See, let me tell you, this process of vaccination is not just in Delhi or Maharashtra. It has to reach to the most remote regions of our country. There are aspirational districts, more than 120 of them, and there where vaccinations drives traditionally have been very weak, and that it has to reach there. And my concern will be myself is to people who do not have a smartphone, who do not know how to log there and put their data. That is a big challenge. And therefore, I think it is, there'll be some challenges, but it is an opportunity for us to vaccinate a majority of our patients. If our country gets a herd immunity level, say after about 50% of our population then we can see a good end to this pandemic, and that's what we all hope for. But till that time, I must say that vaccination is only a complementary strategy in which they are actually, it is going to complement your social distancing, your mask, your sanitization, all the other efforts that you're doing currently. The other thing at the same time, if by permission of our anchor here, is this, that you must know this, that vaccine has an acceptance is a big challenge in marginalized communities where there's more poverty, illiteracy, ignorance, and all these kind of fake news. When we did the MR campaigns in the district of Mewat, I remember there was a huge kind of a WhatsApp this thing where that this vaccine is going to cause you impotence and all the other things. So these are nonsense. I think we need to be very mindful that there will be some mischief creators, and that will cause more anguish to people who really want to get vaccinated. And vaccine acceptance is not just like everybody gets a call and they go. Many times a person has to talk to his family, so there's a lot of social determinants of health. Like, for example, in a village setup, the sarpanch, the village elders and leaders have a big role to play. Any elder in the household has a bigger role to play. Religious leaders have a role to play. Mother-in-laws have a role to play. And we have done some studies on focus group discussions in the regions of Mewat, which is at one point of time had only 13% immunization. Free vaccines of the government, still children are not getting vaccinated. Now it's gone up to 30 and some regions 60%. So I think we need to be mindful of these processes, and therefore the use of frontline health workers like ASHAs, accredited social health activists,
Right.
also the use of Anganwadi workers, the ANMs. The ANMs do majority of the vaccinations in the remote rural locations, and those guys are already getting trained. And I can tell you, we have our teams working in these aspiring districts. They are ready. And the information about safety of the vaccination, there are placards, there are announcements, there are so many things that's going on. And vaccination drive is not going to be easy, even if you have everything going on. So
Correct.
I think we all need to collectively join hands and support the efforts of vaccination drive by the government of India.
Okay, fair enough. Thank you so much for making that point and emphasizing on that. Let me go across a few more viewers. Dr. Praveen Kumar is on the phone line from Hyderabad. Good evening, Dr. Kumar. Go ahead, please.
Yeah, good evening to the panel of doctors. My question is, a sizable amount of healthcare workers in our country are already COVID positive, and they are asymptomatic now. So my question is, already antibodies are elevated in those patients. So there might be a different range of people with lower antibodies, and some might have the higher antibodies. So any trials have been conducted in this case to know that if the vaccine is given for a person with a higher antibodies already affected with the COVID, so is it going to affect them or not? These kind of questions are being asked by many people, many patients.
Yes.
So just I would like to have a clarity on this. Thank you.
Okay.
Yeah. So I can answer this very quickly. That,
yes, go ahead, please.
Yes. So the health workers, even I suffered from a very severe bout of COVID. My antibody levels after 4 months are skyrocketing, but I'm also eligible to get the vaccinations. If you are COVID positive and you have antibody, doesn't mean that you are not going to get COVID vaccine. You should get it, because all these COVID positivities and antibodies, they will reduce and regress over a period of time. This disease is just hardly 1 year old, and we do not know how the seropositivity is going to behave. And it's critical that the frontline health workers get vaccinations. The only contradiction could be if they are suffering from COVID or serious infection in the first 2 weeks or so, they should not be. But as soon as they are ready, health workers should get regardless of their COVID status.
Okay, thank you for that. In fact, that was a query that we got earlier in the evening as well. Somebody who's asymptomatic but has had COVID or may have antibodies, what should they do? Dr. Srivastav, you wanted to add to it? Go ahead, please.
Yes, I think it's important to make one point here. When we say antibodies, they've actually got to be what is defined as neutralizing antibodies. That means antibodies that will have a detrimental effect to the antigen, in this case, which is the virus.
Correct.
Unless it is a neutralizing antibody, it is meaningless. So you could measure an antibody, you could do a titer and say the percentage of antibody is this, but unless it is clearly demarcated as neutralizing antibody, it means nothing. And so the presence of an antibody in itself does not offer you protection. I think, Dr. Praveen, I think it's important to make that point, that antibody is not going to be all protective. It has to be a neutralizing antibody. It has to be 20% of the antibodies that are present in your system. Unless it is there, it's not going to be offering you protection. So this is a myth that your antibody levels are high and therefore you're not likely to get an infection. They will dwindle and disappear, and unless they are neutralizing, they are going to be offering you no protection.
Okay.
I want to add.
Yes. Okay. Dr. Suresh Kumar wanted to add. Yes.
We have 20 healthcare workers, 11 doctors and 9 staff nurses get repeat infection. Even after first infection, if somebody thinks that the antibody will last for more than 6 months or 1 year, it is not true. We have the staff and doctors who are getting reinfection because of their initial antibody level was very high, but soon they developed the reinfection, and we have treated many such cases at our hospital that they have the double infection.
If I may ask Dr. Suresh Kumar, on an average in these cases, what was the time gap between the two infections?
2 to 3 months. Some of the patient can have reinfection. One of the asthmatic sister, she was on steroid, she got infection just after 6 weeks. So you can see the healthcare workers getting reinfection because they are working in the ward, they are working in the ICUs, they are working in the area where viral load is very high. And they have very high chance of getting reinfection. And now the genetic variation is so, you can have the different strain. You can see the UK strain is coming up, and you have the genetic variation, and you can have chances of reinfection. Once you get this sort of vaccine, which protect you fully for the next 1 year, that is good. So it's always advised that one must have the vaccine, even if you had the previous infection with the coronavirus.
Okay, the general consensus seems to be here that it's just advisable to get the shot when you can, even if you've had COVID in the past. Let me go across to Sonali, who's on the phone line from Navi Mumbai. Good evening, Sonali. What would you like to ask?
Good evening. Good evening to all on the panel. I would like to ask, I have a son who is 19 years old now, and he is a CHD child with several open heart surgeries. How safe would it be to get him vaccinated? And when should we wait for his vaccination turn, or should we just get him vaccinated in the first phase?
Well, I think this child should be vaccinated. A 19-year-old with congenital heart disease, I don't know whether he has a processes valve or anything. Like, he has significant comorbidity, and he will qualify to get vaccinated. As per the government policy, and it is very safe. There should not be the safety standards, whether you have comorbidities or you're normal, remain pretty much the same.
Thank you, Dr. Seth, for responding to that. I hope that helps Sonali make that decision when their turn comes, and when the government brings in the next phase of vaccination, which will include people above the age of 50 and those with serious comorbidities as well. Many of our viewers, in fact, have asked this question: how long will we be immune once we've taken the shot? And I'm assuming the viewers understand that the counting only actually begins properly after you've had both your doses. So 2 shots. Dr. Sinha, do we know right now, is there an estimate of how long at least can we be protected?
Yeah, see, like the other panelist was telling about the neutralizing antibodies and that critical level of antibodies. So it's generally the company, these two, Covishield and Covaxin, in fact, both, generally after 2 weeks of the second dose, and then we can expect that we have now adequate protection against the COVID virus, and the antibodies levels are good. So that after 2 weeks, after 14 days, at least after 14 days of the second dose.
Yes. So 2 weeks from the second dose is when the efficacy can kick in properly. But for how long will it stay? Will the impact stay? Because we've not done research for this long on these vaccines.
So now, how long will the protection last?
Yes.
Now, this question remains unanswered as of now, and there cannot be an answer as of now because we'll have to wait. That only time will tell. So the trials are still going on. So and they will be followed for years, at least for a year or two, and then we can come to know only at that time that how long the protective levels of immunity will be lasting. So this question cannot be answered as of now.
Okay.
But I'm sure, but certainly this will be good enough at least. It will be at least longer than what the common flu that influenza viruses offer. It will be at least longer than that.
Okay, fair enough, and this is what we have for now. So we will go with this and hope that as the trials continue, data suggests that the benefit and the protection does stay on for a longer period, or by then we find another solution. Opera is on the phone line calling us from Delhi. Good evening. Go ahead, please. What's your question? Opera, can you hear me? Okay, my team tells me though that what Aubrey wanted to know is where do I stand in the priority group? I'm a heart patient, asthmatic and 80 years of age. When will my turn come? You would be in the next priority group right away. The minute after these 3 crore are vaccinated in phase 1. So in the next couple of months, you will definitely be on that list. And the detailed guidelines of which we will be here to tell you about that at that point of time as the government gives us more and more details. So starting tomorrow, there are going to be a lot of learnings and experiences to report on, to learn from. A big thank you to the panelists who took the time out to join us on this Friday evening. We're all waiting for that one big moment, which is there tomorrow, finally here now, the vaccination drive. The point where we begin a final battle against coronavirus and hope that soon we will be completely rid of it and find solutions so that people can go on to start living their lives normally. It's still going to be a long process. It's still going to take many, many months or at least even a year before we can see that kind of impact. Nevertheless, it's going to be a big day and we'll constantly get you updates tomorrow from across the vaccination centers. And of course, Prime Minister Modi will be addressing country at 10:30 a.m. when he officially inaugurates the vaccination drive. So stay with us.